back live tonight. You're in focus. The Health Department's 2022-2023 financial year report shows that all provincial departments underspent their budget by a staggering 3 billion rands, and this hasn't gone down well with the Health and Allied Workers Indaba Trade Union. In a report in IOL, the Gauteng Health Department is flagged as one of the worst performing as far as underspending is concerned. 2.7 billion rands. For more on this conversation, we are now joined by HAITU President Rich Sicina. Rich, good to have you, and thank you very much for your time. As far as the 2.7 billion is concerned, the department and certainly its portfolio committee believes that that's actually not bad going. The department has spent 95% of its budget. The 2.7 is merely 5% of the budget, and as per the PFMA requirements, if the department has a shortfall of 5% and below, that's not a train smash.
Thank you for having us, Comrade Nzuli. Good evening to the viewers at home and the members of Gauteng Allied Workers in our trade union. You know, it's just an excuse, Comrade Tab. It's an excuse. It's clear with us. We are concerned, but more than anything else, we are disappointed that they are proving now and again that in as far as transforming our public health system is concerned, those in positions of authority, political and otherwise, they are useless. There's nothing we are going to see getting right under their leadership. As it's worse, Gauteng is worse. Even, no matter how they can try to justify 5% or 10%, it doesn't matter. At the moment, we have 27 billion that is going to go back to the coffers of the national treasury, while we have systems and hospitals that are falling apart, while we have hospitals in Gauteng where telecom or whatever, whoever is the service provider, in as far as telephones are concerned, is not paid. Nurses, doctors can't communicate with each other. They are using their own phones. But we have the money that is going back to the coffers of the national treasury, while they actually can't employ doctors, because they were saying those doctors they can't take them because they were crying poverty. They are stopping overtime in the midst of this gross shortage of staff. At least that money was supposed to be diverted somewhere. We have toilets. We have things that are falling apart. Our buildings are dilapidated. There are toilets in certain clinics that are not functional. The patients come into a facility and whatever they are trying to say is just a complete excuse. Obviously, they were not going to come forward in the public domain and declare themselves as failures.
So I think it's precisely what you're raising that they're also using as their reasoning. One is the fact that there are construction programs or projects that have not been accomplished, right? So the underspending is because those construction companies were slow to finish. So they could have budgeted for them, but they can't pay them the full amount because they did not finish the project. So that money goes back to Treasury. Two, it's the very same thing that you're saying, the slow payment to service providers. So they're saying, of course, some of that money is because there are issues in terms of paying service providers within 30 days. So I would assume telephone lines and so on and so forth would fall between that those people are not being paid on time, and therefore their phone lines are being cut, hence the money going back to the Treasury. The other one is they have a budget, right, for trainees, but that budget is only released in the second, third and fourth quarter. And that's when the intake actually happens. So the last quarter of the year, or the first quarter rather, would show that they didn't spend that money because those people were not yet taken in. That is a sum of reasons for why they are underspending. What do you think?
If we can actually, they are talking about symptoms, but because I'm a healthcare worker, I will analyze those particular symptoms and eventually come up with a diagnosis a symptom that says there's no progress in as far as certain constructions are concerned. There's no payment. They're still waiting. They are still waiting for certain equipments to be delivered. Everything is low. It simply says the system indeed is falling apart. There are things that they have failed in this particular space of time from from April last year until today. There are things that they were supposed to do and certain projects that they were supposed to complete, but those projects were not completed. But let's take it a notch higher. They have failed. This is actually a declaration of failure. Hence, we are saying if this was a nurse, if this was a doctor, or if this was a pharmacist or any healthcare worker for that matter, who will take medication back to pharmacy while we have patients who are in the ward, who need to be given that particular medication, and my excuse is to say I couldn't give them because the professional nurse who was giving medication was low to give that particular medication. The truth of the matter is that those things were needed to be done. So there's omission in as far as that is concerned. Just imagine then, because here we are not working with stones here or metals. We are dealing with people. The problems that we are facing on the ground are dire. In a situation where I was making an example with our General Secretary today, that in my line of duty, you will find out we have a patient with severe infection. And that particular patient has to get trazodone, for example, as a last line of defense in terms of antibiotics. You take a script, you take it to pharmacy. Pharmacy will turn it back and say, this trazodone you are looking for is out of stock. How do we go out? How do we explain that, Comrade Thabo, while there's money that is actually not used? In a world where people were actually determined, are passionate, and they are saying we are going to excel and produce quality, they were going to sit down and say there's no progress in as far as certain projects are concerned. But we can't sit with this particular money having to go back while we have gross shortage of staff, while we have gross shortage of material resources, while we have certain service providers that are very important that are not paid. No, it's a complete a sign of I don't care attitude. They are just, we need to make noise and declare themselves and everyone actually in a position of authority, not only MECs, even the premiers of these particular provinces, because MECs report to the premiers, the DTGs and the SODs as well. All of them are killing the country and killing the community. The same community they will want to vote for them come the 29th of May.
So you are then saying all that it's because of one, non-responsiveness, or maybe, if we put it a little bit more clearly, lack of political will, not necessarily lack of aptitude. Do you think these people have competence level to be able to do these things? They just don't care. They just don't put enough, apply enough of themselves to care about those issues.
It's clear. At some point, there is, I don't remember the year, but Pravin Gordhan once said, it was on a national television, but South Africa doesn't necessarily lack financial power, but it lacks implementation capacity. That's where we are. It's laziness, it's an I don't care attitude, and the fact that this is what we need to try to fix and make sure it runs like a well-oiled machine is a public sector. And let's look closer. Who is doing these things? Who is neglecting this public healthcare system? It's the MEC. And this MEC we are talking about, this SOD we are talking about, this premier of this particular province we are talking about is someone who has a medical aid, by the way. They are neglecting this public healthcare system because when they are sick, they go to a well-resourced private sector when they are sick. They are not going to be subjected to go to Ghana, where you will be told that there's no morphine or there's no petadine to control your pain. It's an issue of saying these people, there's no political will to make sure that we fix these particular problems. Well, how do you call a situation where the entire clinic, the entire clinic, toilets, own in that particular clinic are not functional. And when you go to those in positions of authority in that particular clinic, they will tell you that it's beyond our control. We have reported to the central office. The FDC knows about it. The Premier knows about it. We are waiting for them to come, to release people who are going to come and fix these things. Then we need to keep quiet and watch them going up and down. And when things go wrong, it's very quick to throw healthcare workers, nurses in particular, under the bus. We must be clear now that they are also failing the system. We are where we are, and they are using us, healthcare workers in particular, as accomplices of murder. How many persons who were supposed to be saved, by the way, if we had doctors on duty, if we had adequate nurses on duty? There are persons who actually complicated unnecessarily so. So unless they are building those litigations as well, maybe they are getting something out of that. They are happy when we have litigations.
Rich Sicina, I appreciate your time. Let's leave it there. Thank you very much. Health and Allied Workers Indaba Trade Union President Rich Sicina there. All right, when we continue in a moment, the credit agency Moody's has downgraded the city of Ekurhuleni to junk status, while also placing municipality of Tshwane on review for further downgrades. It's one arm of government, but of course national overall, supplying that arm of government with grants and support. What are they saying to these developments?